Okay, so this demonstration is to show you how to perform a stretch of the abductor group, which abductor group again is a muscle that that originates one of the main abductors is the gluteus medius. And so the gluteus medius again originates on the lateral ilium, attaches to the femur, and it will when it contracts, it pulls the femur at the hip into abduction. But when the adductor group contracts, okay, it pulls it and makes the abductor group stretch out. So what we want is we want this motion to occur in order to stretch the abductors or abductor group. So what we're going to try to do is we're going to try to mimic this motion of the femur at the hip in order to stretch the abductor. Now, when we stretch the abductor group, there is a couple of different degrees of flexibility, similar to the hamstring and the quadricep. So I'm going to demonstrate a few options to show you in terms of that particular muscle group stretch of the abductors. I'm going to show you, or the first level of flexibility is an individual, and we'll have them slide to us. Is an individual who is not very flexible with regards to the abductors. And so what we would do is a couple things that I would show you probably not to do as well. We'll show you two different options. And that is when this leg, we can use the right leg, when this leg comes up and we bring it over, a lot of times we can just bring this right leg into adduction, and we could rest the foot over the other leg, okay, if they can get there. Sometimes they can't get there. Sometimes it might be that they are, we put it on this side of the leg and then we just push. But sometimes the muscles get in the way, so that's difficult too. So many times I'll lift the leg and then I will push over in this position, okay, and we'll just hold it. It's very easy to just push the leg into adduction and then just hold that position. Not a lot of work for me as a practitioner, student trainer, personal trainer, athletic trainer, physical therapist, chiropractic doctor, whoever might be stretching this individual. It's not a lot of work on my end to hold this particular leg into this position. And so I would just hold for 30 seconds, and gravity will pull as well. And then again, I would push, let me know when to stop. That's another 30-second hold. And then I would the last 30-second hold, let me know when to stop. And then there is the last 30-second hold for that particular individual. Now, sometimes you might find it stretching multiple people, okay? You don't want to continue to push in this position because it will potentially start to affect the back. Set your arms up in this position a lot, you'll start to feel a little bit of back fatigue and so forth, which we don't want. So there's another option, okay, and that is to stretch from the opposite side. So if I'm on the right side of the body, I can stretch the left leg, and what I would do is I would bring this leg up and over, and I could stretch in this position. But what happens a lot of times is the leg will fall, okay? The foot will fall, which is okay. And then you could use your hip or your leg to wedge against this particular foot, and then press your body up against the lateral side of the leg and push this way. Okay, so this sometimes is a good option. Sometimes their hips can roll a little bit and you can stretch that way, which is fine as well. It's whatever's comfortable for them. So that would be a 30-second hold. So first 30-second hold, I then kind of lean my body forward, second 30-second hold. Okay, let me know when to stop, third 30-second hold. Sometimes we can, if they're super inflexible, we also put their knee up in this position. So we would do this. We would put their knee up first. Let's say it's the right knee, the left leg. We're going to stretch the left leg. Right knee is bent. And then what we would do is we would place it down here. We would bring their left leg up and then set their left leg, if they can get there, on top of their right knee. And then what we would do is we would get on the table. We would put their right foot against our left hip. Okay, and then we can use our leverage here of our body on the foot, and we can use our body to, so this might be a 30-second hold. Okay, and then we would go, okay, let me know when to stop. I come up. I'm just using my body to create leverage for their stretch, right? So I'm essentially creating knee flexion, which at the same time, because the foot is on this knee, this is the lever that we're talking about, and we're controlling it, which is actually putting a stretch on the gluteus medius and the abductor. So we go first 30-second hold. Let me know when to stop. Second 30-second hold. I'm still working on my ergonomics, so I'm safe. Good. Let me know when to stop. Third 30-second hold. I walk my knees up a little bit. And that would be another way to stretch the piriformis and the abductor group in a way that's for an individual who's not very flexible. Now, the second option we can do, let's just say they're flexible, they're not very flexible, but they're more flexible than the first demonstration I showed you while I'll be on the table. I could come up here. Okay, let me know when to stop, and they still don't really feel it. And then what I would do is I would pull. Start to pull their knee back, right? So I would go, okay, let me know when to stop. First 30-second, let me know when to stop. I'm gonna pull back a little bit more. Stop, second 30-second hold. And then third 30-second holds, let me know when to stop. It's not a lot, right? So we're in this position. This is the third 30-second hold. And that also really does a good job of effectively stretching the abductor. Now, another way to complete the stretch of the abductor group, this would be for individuals. Let's say you don't want to get on the table. You would rather stand up, right? It's more based on what you would prefer. Say you're a doctor, physical therapist, trainer, you're stretching multiple people throughout the day. It can get a little bit uncomfortable for you, or it may be something you would want to attempt in a different way to stretch, but it may be uncomfortable for you to continue to have to get up on the table multiple times, right? So a lot of times, me as a practitioner, I would prefer not to be on the table for multiple patients. So I'm stretching, like, well, you're a practitioner, you see 30, 40, 50 patients in a day. And you might be needing to stretch, maybe not that many people, but you may need to stretch quite a bit of individual, quite a few people with regards to their care. And so what we would do, and this is what I've done multiple times as a practitioner with my patients, is stand next to the table, right? Stand next to the table. And so what we would do is we would, again, bend the knee. We're going to bring the left leg over, and we're going to wedge. Sometimes so I'll go to the most extreme. So someone who's really extremely flexible, but we still need to stretch the quad, the abductors, is we can bring this leg up, and now we can wedge ourselves between the lateral portion of their left leg and their lateral portion of their right knee. Okay, so we actually can stretch this individual with the right hip wedged between the left knee and the left hip wedged kind of between the right ankle. Okay, so that's a really good opportunity to complete. So what we would do is we'd wedge it, and obviously there's some resistance here because the muscles in the clothing and so forth. And then we would just keep our right hip on the outside of the right leg, outside of the right leg, and then we would use our hand to push. So it would basically be, and I'm just holding the leg here because it will fall. Basically, it would just be, okay, I go here, let me know when to stop, that's their first 30 second pass. Okay, let me know when to stop, and I'm just pushing. Let me know when to stop, that's their second 30 second pass. Okay, good, let me know when to stop. And then that's their third 30-second pass. And then they're finished, and then we switch legs. Now, some individuals may not be that flexible, you still want to stand up. We get them in here, and they can't get to here where we can wedge ourselves in between their left leg and their right leg, right? So we would basically, at that point, try to wedge ourselves in. So we do the best we can to get a little bit of our bodies in there, to use our bodies more. And at that point, it would be like so. And then I'd have my hand in here. I'm holding the leg up. Usually I'd put my hand in between their knee and my body. Right? I don't want their body parts touching my body parts, my torso and all that stuff, right? I'm trying to, be as safe as possible. So I put my hand in between my body and their leg. And then the same thing would go here, right? Hand here. So it would be their first 30-second hold. Let me know when to stop. I'm pushing third 30-second hold, and I even might be using my body, right, as I shift. Third 30-second hold, stop, or second, then third. Let me know, stop, 30-second hold, stop, and then that completes that particular stretch for the abductors. The last thing, so that completes how to stretch the abductor group. A lot of different varieties on showing you how to stretch that muscle group. The last mobilization or stretch I want to show you, which I think is really helpful. A lot of athletes, patients, clients I've ever had through the years really appreciate this. And that's just a mobilization of, and it's stretching the adductor and the abductors together. But it's really a light, just almost like a dynamic stretch. It's a movable stretch, not a static stretch, what we're doing here. It's more movable. We'll get to that later. And that is, we pull the leg up, hold their hand with their right, hold their foot with your hand, hand on their knee. And then what we would do is we would just bring their leg out into abduction. And we would basically do like perform a circular motion. This is getting a good dynamic movement of the adductor group. We do, I don't know, 10, 15, 20, 30 seconds. Sometimes, I do about 30 seconds of that. And then I would go the opposite way. And this would be getting a good mobilization of the hip joint as well. And it also would stretch the abductor group. So I would come in like so, right? Abductor stretch. Again, a good abductor stretch, right? And then I also could move it around. So I could adjust it. I could go into adduction and then into abduction, right? So what I mean by that is I'm going into adduction to stretch the abductor. So I'm going into this movement to stretch the abductor group. I'm going into this movement to stretch the adductor group, okay, the AD deductors. So adduction, I'm stretching here, a few mobilization, a few circles, and I come back into abduction as well, or to stretch the abductors as well. as I move into adduction, right? So just nice, easy, slow. I guarantee if you perform your stretching technique on a partner as you're learning these techniques, you can try this nice, easy stretch mobilization, and it will be really helpful for them, and they would certainly appreciate it, as many clients and patients I've had through the years have appreciated that additional stretch. So that completes, again, the final portion of the abductor movement, with a little bit of movement that occurs at the hip joint to, again, finish up the stretching of the adductors and the abductor group.